My name is Marcus Burns. I'm over the age of 18, and I give Chamberlain permission to use this for educational purposes. Come in.
Hello, Mr. Burns. My name is Christina, and I'm going to be the nurse taking care of you today. I'm going to be performing a head-to-toe assessment. It's going to take me about 30 minutes. Are you okay with that?
Yes.
All right. So first I'm going to perform hand hygiene. And then I'm going to close the curtain for privacy. Mr. Burns, can you verify your first and last name?
Marcus Burns.
And your date of birth?
5/19/1985.
Do you have any allergies, Mr. Burns?
No, I do not.
Okay. And are you in any pain?
No.
Right. So Mr. Burns appears to be his stated age. There is no signs of distress noted. Mr. Burns, he seems to be in a good mood. He was smiling, making eye contact. He is dressed appropriate for the weather and occasion. When responding to my questions, he was coherent and his speech was clear. And he seems as if he has bathed and he is well groomed. Mr. Burns, do you know where you are?
Yes, in the doctor's office.
Okay, and why are you here?
For an assessment.
Do you know today's date?
Yes, April 22nd, 9:30.
Okay, and what is today, what time is it?
9:30.
Okay, Mr. Burns is alert and oriented ×4. No physical abnormalities noted or no physical devices utilized. All right, so now moving on, Mr. Burns' vital signs. His temperature was taken orally, 98.6 degrees. His pulse was 80 beats per minute. His chest respirations was 14. Oxygen saturation was 99%. So all of his vital signs are within the normal range. All right. Okay, so moving on. I'm going to look at Mr. Burns' skin. So looking at Mr. Burns' skin, it is appropriate to his ethnicity. I don't see any redness, swelling, lesions, wounds, or incisions. Let's see, Mr. Burns, I'm going to palpate your skin. Mr. Burns' skin is warm to touch. I'm going to pinch your skin. Okay, so Mr. Burns' skin had quick elastic recoil. It was quick elastic recoil. All right, so now Mr. Burns, I'm looking at Mr. Burns' nails. They are clean, round, smooth. He has pink undertones. I don't see any redness, swelling, lesions, incisions, or wounds. I'm looking at the nail profile. It's roughly about 160 degrees, so there is no evidence of clubbing. Mr. Burns, I'm going to test your capillary refill. Thank you. So capillary refill was less than 3 seconds, so it was nice and brisk. So now looking at Mr. Burns' face, everything is symmetrical. His nose is midline. His smile is symmetric. I don't see any rashes, lesions, swelling, wounds, or exudate on his face. Now I'm going to palpate your head, Mr. Burns. Is that okay with you?
Yes.
All right, Mr. Burns' head is normal cephalic. It is midline to the body. When palpating his head, I didn't see any lumps or masses. And then he does not have any hair and there are no infestations present. All right, so now Mr. Burns, I'm going to test his cranial nerves. So starting out with cranial nerve 5, Mr. Burns, can you clench your jaw for me while I'm palpating the masseter? Down, you can do it now for me. And then also the sensory function, Mr. Burns, I'm going to use, I want you to close your eyes and I'm going to touch places on your head. When I do that, I just want you to say the word now, okay, as you feel me touch you.
Now. 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 Now.
Okay, thank you, Mr. Burns. So that was cranial nerve 5, so his sensory and his motor function for that one is intact. Now moving on to cranial nerve 7. Mr. Burns, can you frown for me? Can you smile? Can you lift up your eyebrows? I'm sorry. Can you puff your cheeks? Can you pucker your lips? So Mr. Burns, cranial nerve 7 is intact. Now moving on to cranial nerve 11. So Mr. Burns, what I want you to do, I'm going to ask you to shrug your shoulders and I'm going to push on it with resistance. So Mr. Burns, can you shrug your shoulders for me? Okay, thank you, Mr. Burns. And then can you move your head from the left side and then back to the right side for me? right, thank you, Mr. Burns. So those, well, it was cranial nerve 11 intact, so cranial nerve 5, 7, and 11, they are all intact. All right, so now I'm moving on to Mrs. Burns's eyes. So looking at Mr. Burns's eyes, they are symmetric. I don't see any redness or swelling or discharge coming from his eyes. Looking at the sclera is white. I'm gonna pull down your conjunctiva. Okay, so Mr. Burns' conjunctiva, I didn't see any wetness or swelling or exudate or discharge noted. He had pink undertones, and I already said no redness or swelling. Mr. Burns, I'm going to looking at your pupils. So Mr. Burns' pupils, they are equal in size, they are round, they were reactive to light. And Mr. Burns, can you please just follow my pen light? And accommodation noted. So that is what we call perler. All right, so now Mr. Burns, I'm going to test your cranial nerves 3, 4, and 6. So what I'm going to do with that, I'm going to do the cardinal grays. Okay. So all I want you to do is follow my pen light as I move it. Okay. Thank you, Mr. Burns. So cranial nerves 3, 4, and 6, they are all intact. So next, I'm going to move on to Mr. Burns' ears. Looking at the external auditory meatus, I don't see any redness, swelling, no lesions, discharge, or cerumen coming from his ears. Mr. Burns, let me see here. He has piercings in his ears bilaterally. It looks like though they have all healed. I didn't see any redness or swelling there. So they have healed and there are no rashes or skin breakdown in his ears. All right, so for this one, Mr. Burns, I'm going to test your cranial nerve 8. I'm going to do the whisper test. So for the whisper test, I want you to occlude one of your ears. I'm going to whisper something to you, and then I'm going to do the same thing on the other side.
1, 2, 3. A, B, C.
Thank you, Mr. Burns. So cranial nerve 8 is intact. So now moving on to Mr. Burns' nose. Looking at his nose, it is midline, it is symmetric, it is proportional to the rest of his facial features. Looking at, and I don't see any redness, swelling, lesions, rashes, or exudate on his nose. Now I'm going to look inside his nose. Looking inside of Mr. Burns' nose, I didn't see any inflammation. His septum was midline, it wasn't deviated. I didn't see any deformities or no deformities. And so now I'm going to test Mr. Burns' bilateral patency. So Mr. Burns, what I want you to do is I want you to occlude one nostril, breathe in, and then and out, and then we're going to do the same for the other nose. Go ahead. Did you have any trouble breathing, Mr. Burns?
No.
All right. So Mr. Burns, his nostrils were patent bilaterally. So moving on, I'm going to move on to Mr. Burns' mouth. Looking at his lips are pink, moist, and intact. Mr. Burns, can you open your mouth for me? Looking at Mr. Burns' tongue, it is pink, moist, and intact. And also looking at his gums, that is also pink, moist, and intact. So now I'm going to test your cranial nerves, cranial 9, 10, and 12. So usually for cranial nerve 9, what will happen is that we will use, that will be the tongue depressor where we place on the tongue, and then that will be the gag reflex. But for this purpose of this video, we won't be doing that. But for cranial nerve 10, Mr. Burns, can you say ah for me?
Ah.
So as Mr. Burns said, his uvula rose, so cranial nerve 10 is intact. Mr. Burns, can you stick out your tongue for me and move it side to side? Thank you. Okay. Okay, so that is cranial nerve 12. So all cranial nerves 9, 10, and 12, they are all intact. All right. So moving on, looking at Mr. Burns' chest, I don't see any work of breathing noted. I don't see that he is using any accessory muscles for breathing. It looks like he is sitting erect. I don't see any evidence of scoliosis, lordosis, or kyphosis. All right, so now, Mr. Burns, I'm going to listen to your interior lung sounds. So, Mr. Burns, as I'm listening, as I move my stethoscope on your chest, I just want you to take a deep breath out. Okay, in and out. So here we go. Right upper lobe, left upper lobe, left lower lobe, right middle lobe, right lower lobe, left lower lobe. So Mr. Burns' interior lung sounds, oxytata, they were clear vesicular sounds, clear vesicular sounds throughout. Mr. Burns, can you turn around for me so I can do the posterior one? Left upper lobe, right upper lobe, right upper lobe, sorry, right lower lobe, left lower lobe, left lower lobe, right lower lobe. Okay, you can turn around, Mr. Burns. Thank you. So those two were clear vesicular sounds throughout. So now what I'm going to do is I'm going to palpate Mr. Burns' carotid arteries. Do the carotid pulse. That was 2 plus the regular rate and rhythm. Now the other side. That was also 2 plus the regular rate and rhythm. I'm looking at Mr. Burns' upper extremities and lower extremities. I don't see any edema noted. Okay, so moving on, I'm going to auscultate the heart sounds. Aorta, which is a second intercostal space. Pulmonic, which is the second intercostal space. Erb's point, which is the third intercostal space. Tricuspid, which is the fourth intercostal space. And the mitral, which is the fifth intercostal space. No S1 or S2 heard. Well, S1 and S2 were heard. No S3, S4, or no murmurs. Now I'm going to auscultate them with the bell. Aortic, pulmonic, which is the second intercostal space. Erb's point, which is the third intercostal space. Tricuspid, which is the fourth intercostal space. And then mitral, which is the fifth intercostal space. So S1, S2 were heard, no S3, S4, and no heart murmurs. Okay. So now, Mr. Burns, I'm going to palpate your radial pulses bilaterally. So those were 2 plus the radial rate and rhythm. Now I'm going to do the dorsalis pedis. Mr. Burns, with your foot. Now the other one. Thank you, Mr. Burns. Those were also 2 plus the radial, 2 plus the regular rate and rhythm, and then now the back of the foot will be the medial malleus bilaterally. Thank you, Mr. Burns. So that was also 2 plus the regular rate and rhythm. Looking at the hair on his lower extremities, all of his hair was distributed evenly throughout. Okay. So now, Mr. Burns, I'm gonna need you to, if you can please stand up for me and then lay straight on the couch for me. On your back. Lay on your back. I want you to be auscultating your abdomen. Thank you, Mr. Burns. Put your arms down. All right. So looking at Mr. Burns's abdomen, it is flat. It is symmetric, no asymmetry. I don't see any no redness or swelling, lesions on or escudate. Also looking at he has pink undertones. Mr. Burns, I'm going to listen to your going to listen to the abdominal aorta. So listening to the abdominal aorta, I don't hear any pulsations or no bruits. Okay. All right. So now I'm going to be auscultating the bowel sounds. So what auscultating the bowel sounds, I'm going to start with the right lower quadrant. Right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. Okay, so Mr. Burns has normal active sound, normal active bowel sounds throughout. So now I'm going to palpate those same areas. Mr. Burns, each place that I palpate, if you feel any tenderness or pain, would you please just let me know?
Yes.
Okay. Right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. Any pain or tenderness anywhere?
No.
All right. Okay, thank you, Mr. Burns. So there was no tenderness or distension. Mr. Burns, you can sit up for me and get back in the chair. Sorry about that. Mr. Burns, can you tell me when your last bowel movement was?
About 3 p.m.
Okay, and thank you. And then do you have any urinary frequency?
Yes. No.
Do you have any urinary frequency?
No.
All right, thank you. And then when urinating, do you have any burning sensation?
No.
Okay. All right, thank you, Mr. Burns. All right, so now moving on to the musculoskeletal. What I'm going to ask you to do, so Mr. Burns, first I need you to extend your arms like this and then move them up like a bicep curl. Okay. Do it again for me. Okay. All right. So looking at Mr. Burns' elbows, I don't see any redness, swelling, or deformities, and he has full range of motion. Okay. So moving on now, Mr. Burns, I'm going to ask that you, so Mr. Burns, I'm going to ask that you wave bye-bye. or sorry, this is wave bye-bye. Okay. And then shake it off downward. When Mr. Burns did that, I don't see any redness, no swelling or lesions. I don't see any deformities, and he has a full range of motion as well. So now I'm going to test your muscle strength, right? So first, Mr. Burns, what I want you to do is hold your arms up with your elbows like you're about to lift some weight. Okay. So I'm going to push them, and then I want you to try to push them back for me. Okay. No, don't move to the side. I'm going to push. You're going to push back. Okay. Thank you, Mr. Burns. All right, and then for your hands, Mr. Burns, can you squeeze my hand for me? Okay. All right, so Mr. Burns is 5 out of 5 full strength with his upper extremities. And now, Mr. Burns, for your knees, I'm going to try to push up against your knee, and I want you to push against it and then extend. Okay. Go ahead. Thank you, Mr. Burns. Thank you, Mr. Burns. Okay, so with Mr. Burns, and then now I'm going to do your ankles. So for your ankles, I want you to try. I'm gonna push them in. You try to push them back against me, and then I'm gonna pull them this way, and I want you to force them back for me. Okay. Here we go. Thank you, Mr. Burns. Push them back. All right. Thank you. So Mr. Burns had 5 out of 5. 5 out of 5 strength. And that is noted. All right, so now I'm going to do the sensory part again. So Mr. Burns, what I want you to do is I want you to close your eyes, and then as I touch different parts of your leg, just say the word now. Okay, should you let it go?
No. 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 No.
Okay, all right. So his sensory function and his lower extremities are intact. Now, Mr. Burns, can you please stand up for me? Okay. So I want you to go stand over there, and then I want you to walk. You're going to walk this way to the end of the couch, and then walk back the other way for me. All the way to the end. Sorry. Thank you. Great job, Mr. Burns. Okay, you can sit. So Mr. Burns is had his gait. He had steady coordination. All right. So Mr. Burns, are you in any pain?
No.
Okay. Do you need anything?
No.
Okay. So what I'm going to do is I'm going to lock the bed. I'm going to put it in the lowest position with the bed rails up. Mr. Burns, here's your call light just in case you need anything. Just please feel free to give me a call. I do want to thank you for allowing me to perform this assessment, and I'm going to perform hand hygiene on the way out.